They could always check in at Hawkeye. I know there's a couple scholarships out there that are specifically for nurse aid. Um, Iowa Workforce Development has been wonderful as far as like individuals that may have been laid off or lost their job.
Oh, yeah.
They have, said, refer people to us. So that would be another resource.
Yes. And then you had mentioned some of the other programs such as like the Med Aid course. For a person that's looking at going into that, is there a prerequisite? Do they have to have their CNA first?
Yeah, for some of them they do. Rehab aid, activity coordinator, and the Med Aid course. You have to be working at a facility for at least 6 months, and you have to have your CNA, your certification, and your facility has to refer you.
Okay. And then with the CNA, you mentioned that a person going into CNA, they wouldn't have to necessarily have their GED yet. At some point, do they have to have their GED before they're employable, or can they actually gain that skill and go right into employment?
You can go right into employment with the CNA. I guess it just depends on what your facility is recommending or what they're requiring. But we partnership with the high schools. We've got our healthcare academy. So we have individuals 15, 16, 17 years old.
Yeah,
18
I've seen that.
taking our classes. Right through their high school. We send instructors right to the high school to teach, and they're able to successfully complete the class and then take part in the state testing. So.
And it's interesting, because I think we had a high school class at MOK at one point, some high school students, and between the high school students and the traditional student age students, and even the non-trad age students, it seems like that particular field, the health sciences field, draws a certain personality. And I'm talking about, the perfect personalities, because they're always cheerful and, always in a good mood, it seems like, and always happy. And it seems like they're happy to learn and happy to be there. They're not looking at it as, in here. It's like they're always looking forward to being there. And so I think those types of personalities transfer well into those fields where you're going to be working with helping people, because I've been a patient a couple of times in the hospital and having a nurse or anyone that's working with you. Sometimes, you're not in the happiest of moods, and when someone comes in, they can just kind of cheer you up and brighten your day, even if you're in, massive pain, And I think that's really awesome too.
We're always looking for caring and compassionate individuals that bring that smile, that sense of cheer.
Yes.
It's really nice. And, in fact, I was talking to some potential students that have been calling lately, as well as like other colleges, for individuals seeking to get into medical school. And they're actually recommending or requiring their students to take a CNA course.
Oh, that's great.
And gain that contact hours as well as that bedside manner before they proceed into their medical program. So that's really nice to hear too, because I think becoming a CNA, I think anybody that's considering working in healthcare should maybe consider working as a CNA, because it kind of gives you a taste of, you're working with people.
Yes.
A CNA has more contact with a patient or resident than anybody else in the facility. Wow. And so I think if you work as a CNA, you're going to learn them skills. You're going to decide, is this for me? Do I really enjoy working with people? Do I have that bedside manner? Am I caring? Am I compassionate? Can I do this?
Yes.
And I think it's a wonderful idea when I see people that started out as nurses aides and now they're doctors or they're nurses, or rehab aides or med aides. It's just amazing to see where you can start here and work your way up.
That's fantastic. And I think too, it's one of those fields that no matter how advanced technology gets, you're not going to be able to, at least not for the next few hundred years, be able to replace a person working in that capacity with a computer or a robot,
Yeah, I don't think computers will replace the people skills that are needed. I agree.
Then you mentioned pharmacy tech, and I wanted to talk a little bit about that one, because back in 2008 we did a community survey asking the community in our immediate service area of the Martin Luther King Center what they wanted to see at the center, and the the choices were truck driving, CNA, and pharmacy tech, which I hadn't heard of before. Those were like the top 3 choices, I believe. Can you tell me what is pharmacy tech?
A pharmacy tech is basically an individual that assists the pharmacy, maybe, stocking the drugs or medications, in the pharmacy. They don't necessarily do like the fine-tuned things like read the orders, fill the bottles, the kind of stuff like that the pharmacy really needs to do, but they're basically just an assistant to the pharmacist. And that is a really good program, especially for individuals who are maybe thinking of going on and becoming a pharmacist, because you learn so much, from working with the pharmacist, and you learn so much, as far as like people skills and how to handle the customers, and you learn a lot about, the medications. You learn a lot about disease processes as far as like why this medication's ordered. I mean, it's
Really?
a really good basic course to take, and then build on later on.
How long is that program?
That program is about a semester long.
And then is there traditional financial aid available for it, or kind of have to find private funding sources?
I think private funding sources for that, because it's not really considered a credit course.
Okay.
Or accredited program.
Okay. And then medical billing and coding, I've heard that one before. But I want to talk a little bit about some of the pay ranges for some of the different areas once you complete. So for a person that completes a pharmacy tech program and maybe gets hired on at a Walgreens, for instance, what can they kind of expect to earn?
That's considered like an entry-level position. So depending on where you work, you're looking at, if you're working in a smaller town pharmacy or a bigger city, anywhere I would say between 20 and 30,000.
Oh, okay. Ma'am, you mentioned between small town and bigger city. With, finishing a pharmacy tech program, is it transferable across the country, or is it just Iowa specific if you do it in Iowa, or Illinois specific if you do it in Illinois?
I'm not sure on that. I guess I haven't looked into it, but I know every state sets up their own guidelines as far as like scope of practice.
Okay.
And I know it's quite different than the Nurse Practice Act, where your license is transferable.
Okay.
But that's something that, students ever want to know, I can definitely look into it and find out.
Okay. And then a person going into CNA, finish the program, kind of what can they expect pay-wise between the nursing home and if they get on in a hospital?
Again, it depends on the size of the town too. But they are looking at anywhere, starting out without a certification, usually about $7 to $7.50 an hour. And then I would say after certification, it's anywhere from $8 to $12 to $13 an hour.
Okay. And then, so I finished CNA, I decided to do rehabbing, I finished that. What can I look at as far as a bump up in pay?
Anywhere between 50 cents and $1.
Oh, wow. Okay, great. And then you mentioned the Med-Aid course. The prerequisite for that, again, CNA,
Yep.
and 6 months, is it?
6 months employment, no referral by your facility.
And then with that, eventually lead to a paid
Yep.
rate? Okay.
50 cents to $1 an hour for every certification you obtain.
That was great. And then a lot of times we do get the calls, you mentioned, basically getting recertified for those who maybe let their certification expire. How long is your certification good for?
When you're on the registry, as long as you're working and your facility is reporting that you're working, you'll stay on the registry.
Oh, okay.
If you decide, well, I'm going to take a break and I'm going to go to school, which I see a lot of people do, you're on the registry for 2 years. After that, if nothing's been reported, then you basically fall off the registry. So then what you need to do is you need to participate in state testing, again, doing the skills, as well as the comprehensive exam. And if you successfully complete that, then you're back on the registry.
Okay.
And then I see students that, maybe started out as a nurse's aide, they thought they'd like it, well then they decided they wanted to do something else, so they haven't been on the registry for 3 years. And, you know, curriculums change, information change, healthcare is ever changing.
And I was just going to ask if that happens.
Yeah, so what's nice about the refresher course is, you know, we go ahead and we give our students, it's part of their tuition, we give them a manual with all the skills so they can actually look at them, they can practice them, we go through them, we go over some sample comprehensive exam questions. It's just an 8-hour course that's held, you know, in one day. We don't break it up into 2 days. And we usually hold it the week before testing. So then you're refreshing at the college, and then you take your booklet home and you practice for that week, and then you participate in testing.
That is fantastic. Well, we're coming up on the last minute of the show. So I want to give you this opportunity to share with the listeners any upcoming programs that you want to make sure they know about, or any upcoming activities or schedules. So with that, I'll let you take it away.
Well, right now, I would say our summer session is pretty much full, but we have about 12 different schedules individuals can choose for the nurse aid class this fall, and students can enroll at any time with that. We do hold like med manager, certified medication aid, and the supervisory course pretty consistently, about every 6 weeks. So finding a class for that's usually not too big of an issue. This fall, you can look ahead for the Nurse Aid 2. I'm hoping to offer a minimum of 2 sessions, but I'm trying for 3 or 4 sessions. So that's just some of the stuff coming up. So.
Great. And then there was a question at one point that we were getting from a lot of people in the community. They were wondering if the MLK Center might be getting an opportunity to have night classes for nurse aid.
I'm really interested in offering more night classes. So we did offer one this summer. However, there were 15 schedules. I think that was quite a bit to choose from, because we usually have about 10. So because of that, I had to cut a couple classes due to lack of enrollment. But you know, anybody interested, I'm always willing to take suggestions, take notes, take your name and number, and put something together. And my number, if you have questions for me direct, is 319-296-2320, extension 1256.
Fantastic. And then do you have any ideas as far as new programs you might be bringing to the MLK Center? Will there possibly ever be like a pharmacy tech or medical billing and coding if the need arises?
If the need arises, yeah, that would be a wonderful idea. Again, I'm trying to put together a needs assessment for the community.
Fantastic.
So once I get that out there and start getting responses back, I'm looking to take our programs and excel them and expand them as much as possible. So.
Well, I want to thank you again for being my guest today. And again, I think the college made a fantastic decision when they brought you on board. It seems like all the right players are coming together for the college, and I see big things for the college and for the MLK Center as well. So again, I want to thank you this morning. Listeners, you heard it here first. So if you have questions, again, you can give us a call at the Martin Luther King Center at 319-296-4440. Or if you have questions regarding any of the health sciences programs that you heard about today, you can call Elizabeth Cummings at
319-296-2320, extension 1256.
All righty. Well, get out there and enjoy that great weather, everybody. And until next time, we will hope that we enjoy it too. You've been listening to Opening Doors. Thank you.